guys, and welcome back to my channel. So if you are new here, welcome. My name is Sarah and I am an American expat living in Kraków, Poland. I've lived in Europe for about 3.5 years, almost going on 4 years at this point, and I just love sharing about my life here in Poland on my YouTube channel. So thank you guys so much for clicking on this video and tuning in, because today we're going to be talking all about the differences between healthcare in America and in Poland. Again, I've been here for a few years now, so I feel like I kind of have a good idea of what you can get with healthcare in Poland versus what you got in America. So I hope you guys find this video informative and helpful. So be sure to give this video a thumbs up and subscribe to my channel for new videos every single Wednesday. I talk a lot about my life here in Poland, as well as some interesting things that are different from Poland and America. So I hope you guys stick around, and let's go ahead and get started with today's video. So I think we kind of all know by now that America's healthcare system is so different than anywhere else really in the world, and that it is the most interesting of all the healthcare systems. So for years and years, I thought that that was like the only way that it was done. And I really didn't know what it was like in other countries because I had never lived in another country in order to get healthcare from there. And so when I moved to Europe almost 4 years ago at this point, I was really blown away by the type of healthcare I got, the different quality of healthcare, the price difference, and all of that. So today we're going to be breaking down the cost difference as well as my experience with different countries like Poland versus America for your healthcare system and kind of what you can get. So when we moved to Poland, we actually ended up getting private health insurance because me and my husband both work from home. We are not with a company, and so because of that, we needed to be insured, and it's also part of our visa process. So we had to buy our own health insurance, and because of that, we actually decided to go with a private health insurance company, and we did that simply because all of the doctors would speak English, and the people who would be booking these appointments for us also speak English as well. And so, not to say that we aren't trying to speak Polish, we are, but when it comes to specific medical terms and things that are a bit more complicated, I would feel a lot more comfortable having a doctor be speaking English to me when it comes to my own health. And so because of that, we pay 180 US dollars every month for our health insurance, for both of us, for everything. This covers, like, there are no deductibles, no copays, anything. So this is a straight out fee. There are no hidden costs associated with it. The only thing that would be different for you to pay out of pocket for would be your medicine. So if you have different types of medication that you need to go to the apteka for, you would just, again, pay cash for that. So we're not, like, that's really not included with the cost of your health insurance, but the overall insurance, what you get for 180 US dollars every month for two people, includes everything: ultrasounds, MRIs, x-rays, all of the really expensive stuff. It's just included. So I think that is incredible, and I'm really blown away by the cost. And then we're going to talk a bit later here about what you actually get for your money with that. But just in terms of what you pay, I know it's like the most expensive plan that you can get here in Poland. It is incredibly affordable, as we're going to talk here in a minute about what we paid in America. But I know, like, the average person is not going to be paying $180 every month for their health insurance. You know, you could pay like $20 to $30 every month for your health insurance. Again, we're just paying a bit more because we want those English speaking doctors, especially when it comes to certain types of things. Now let's break it down for the US. I lived in America. My husband had a job that actually covered our health insurance. So how it worked was that the company had different plans for the health insurance that, you know, you could choose what you wanted to do. And so we chose the lowest paying insurance plan, which would only cover like the bare minimum. And for the company, they paid $2,500 a month for he and I to have insurance. But of that, we would only be charged $200 a month. It's just like this whole insurance company stuff. It's like a big mess behind the scenes. But when you break it down, we ended up paying $200 a month total for both of us. And that did not include anything. That was, again, like the very, very bare minimum basic cost for everything. So if you went to the doctor's office for like a basic checkup, yes, I mean, like, you could go to the doctor, but then you'd have to pay your deductible, which was usually about $50 every time you went. So if you went to see the doctor to renew your asthma medication, $50. You know, it'd be, you go to the dentist, that's another $50. It's just, every time you went to a doctor, you would still have to pay your deductible regardless of the insurance plan you had. And I will say that we actually knew people who paid 2 to 3 to 4 times as much as we did every month for insurance, because the more you would pay for the different plans of your company, you would get more out of it. So like us, again, we had the very bare minimum, which meant that if we were in a car crash, the company would cover, like the insurance would cover up to a certain point. And that's pretty much all we had, because we're just not sick and we don't need a lot of additional things, but other people would choose to have more and more things tacked onto the insurance, which meant that their costs would go up significantly every month. There were people who we knew paying $700, $800, $900 every single month just on their insurance. Again, that's not including your deductible or anything like that. So just kind of like a little story here. I actually have asthma, and so that's kind of why I'm using this example. But I remember this one time I actually had an asthma attack on a Sunday. And again, no doctor's offices are really open on Sunday. So I went to the ER for an hour just to get some albuterol and to kind of, help me breathe better so I wasn't going to, pass out and die. So we were there in the ER for 1 hour. And of course, insurance covered part of that visit. But what we ended up paying out of pocket was $450 out of pocket. And we had insurance. Yeah, it was crazy. And that was just for 1 hour for albuterol for asthma. So that was super crazy. And I feel like even when it came to like the medications, the insurance would only cover a certain amount. And so like, again, with my asthma, I had like a disc for, like my asthma. So I'd have a disc, and then I would also have a rescue inhaler. And the disc, it was about $300 every month, and you had to get it every single month. But insurance covered, I think, $250 of that. So I would have to pay $50 every month anytime I picked out a new disc for my asthma. That was not including the actual like rescue inhaler. It was about the same price. I think it was like $25 for the rescue inhaler. So it was a bit cheaper, but again, it was still like the insurance, just they charge so much for the medication, and you would still pay that much extra out of pocket. So again, it didn't matter what kind of insurance plan you had, the insurance would still just charge that much. So it's different for every medication, every situation, but that's just kind of like my experience with asthma, specifically in the US. And then really kind of like the last thing to note is whenever you had like, so you had your insurance, then you had, like the certain amount that you paid every month and their deductibles and all of that kind of stuff. And then when it came to if you were to do an ultrasound or an x-ray or an MRI, you had to go to the doctor, get their checkup, get a prescription to make an appointment for something else, like more of a specialized type of thing. They wouldn't just be like, okay, well, you need an ultrasound, let me just do it real quick. You would have to go see someone different and wait 4 to 8 weeks probably in order to get in to see, like, get an ultrasound or MRI or whatever. And then you again have to pay out of pocket for those services. They're not usually included with the insurance you have. Again, only speaking from my experience, maybe some insurances are different, but with what we had in our plans that we had to choose from, it was not included. So anything extra like that is stuff you do have to pay for, which is crazy because, like, to me, that just seems so normal. And then I moved to Poland, and that was not my experience. So my experience in Poland was very different than in the US, as you can probably already imagine since we're talking about it. So basically what happened was when I came into Poland to get all of my insurance taken care of and like started making my appointments, I needed to renew a few things. I needed to renew my birth control, and I needed to also renew some of my asthma prescriptions. And I was like, well, I mean, I just got to do it. So I went in and made all my appointments. And in the US, I was just so used to like certain protocols and certain things that when I actually went in to go get my birth control renewed, they wouldn't actually renew it for me unless I did a whole bunch of different exams. And then I came to realize that these exams happen every single year, all the time, regardless of your age. So you would have different examinations of your entire body, not just like poking and prodding, but also ultrasounds. I have on an annual year 3 to 4 ultrasounds every single year of all of the important lady bits. And in the US, that was not something that was ever normal. I never once had an ultrasound there. I never had, any kind of exam. I never had, I mean, other than just like a low ball type of exam. I didn't have like anything intensive or anything like that because I was young and they didn't see the need for that. Whereas here, it seems a lot more preventative. And by giving you the ultrasounds every single year for all of the things that you need, they're able to really tell and catch if something is happening to you at a very fast rate. So I actually really appreciate that. And It was also a little weird because, anytime you go in for an ultrasound, they just don't do the ultrasound and then like have you leave. They print off the ultrasound and hand it to you. And you're like, well, what am I going to do? It's like a picture of my thyroid. And they're like, yeah, it's okay. And it's like, what am I going to do with it? And it's like, I don't know. Like, you just keep your ultrasounds. So I have so many ultrasounds of different parts of my body just hanging out in my office. And it's just like so weird to have my different ultrasounds. And I mean, I get it. I think it's cool, but it's just like so different to me to have pictures of different areas of my body in ultrasound form. And yeah, so anyways, I think that was a very interesting difference when it came to my actual experience here in Poland. And then another difference is that I actually don't have a wait time when I go in to see the doctor. So in the US, we'll talk about this here in a second, but in the US, it was a drastically different experience for wait time than it is here in Poland. Again, I'm only talking about my experience with the health insurance or like the company I'm with for my healthcare. But in my experience, it's like a 5 minute wait time. It's a 15 to 20 minute appointment with a doctor. You're in and out in less than 30 minutes, and you can just move on with your day and not have it take up all your time. And that was absolutely not the case for me, at least in the US. And like really the last experience that we've had here in Poland with healthcare is actually when it came to my husband. So he actually herniated a disc in his back, I guess. And that was a long process to try to get it fixed and having him feel better. And so because of that, he got some x-rays, he got an MRI, and it was not hard to get an MRI and an x-ray. I mean, he went to the doctor and they said, yeah, sure, go ahead, schedule an appointment for tomorrow. And then he went in, got the MRI and the x-ray done. It took maybe 15 minutes. And next week, he got all the results back. And there you go. I mean, like the results, they gave him the results on a CD-ROM, which is so outdated these days, but I mean, it was like on a CD form and you had the option to download it or really whatever it was, but you could look at all of your results and then you just made an appointment in the next few days to go over it with your doctor, and then that was it. And again, because of the health insurance, I guess that you can call it here, it was all free and it was all included. So I mean, that would have been thousands of dollars in the US had we had to pay for MRI and x ray. But no, I mean, it was all included and it was incredible care, very high tech, very modern everything. And I just thought that was amazing. And then lastly is all of the records for you personally are actually all digitized. So they are all online, all on the computer, and it doesn't matter what doctor you see because in my experience I've never had the same doctor twice, but they all can look my records up on the computer and they can see everything. So my husband had the x-ray and the MRI. It doesn't matter what doctor you went to, they can just pull up your file and like that clip is right there. For me, all of like my blood work, my ultrasound results, all of that, it's all on my file online. And so they just enter in, my pestle number and my name and date of birth or whatever, and it all populates and it's just right there. So it didn't matter what type of doctor you saw, they could just see everything and kind of keep it all updated in one spot, which I thought was really great. So now let's go ahead and compare my experience in America versus what I've just talked about here in Poland. So in America, it's very, very different. So anytime I went in to go see the doctor, I would show up on time for my appointment. It would usually be between an hour to an hour and a half waiting time in the waiting room before you even got into the exam room. So you get to the exam room, you wait for a while, like an hour, and then the doctor shows up, gives you the exam, and then you leave. So it's like a huge process. Again, just based on different doctors I've been to and that I've seen, I know sometimes it can be a little bit different everywhere else. But from my experience, that was kind of what I had to expect, is really block out like my whole afternoon or a good part of my morning in order to go see a doctor just for something basic like getting my asthma renewed or anything like that. Another interesting thing that I always experienced in the US was anytime I went to the doctor, they always took the exact same type of anthropometric measurements. So whether it was your weight, like they always weighed you, they always took your heart rate, they always took your blood pressure, and they always looked at your eyes or, just like felt like your lymph nodes or things like that. It was always the same. It didn't matter where you went, what you're in for. That was pretty much what they went and they did. I mean, other than like going to see the eye doctor or the dentist, they wouldn't do that. But like for like a basic general doctor or, a woman doctor or whatever, they would always take your weight. And here in Poland, they don't do that. And I thought that was such an interesting thing because the first time I went to a doctor in Poland, I was like totally expecting them to like weigh me and do the heart rate and everything. They were like, why would we do that? But in the US, they do it for every single visit. So I thought that was also kind of interesting. And then, like how we were talking about earlier with Poland having all of the digitized records, you don't have to like constantly be explaining to the doctors really what's going on unless you just have a few additional things you want to update them on. But I felt like in America, anytime I went to a doctor, regardless if it was like my own doctor or someone different, I had to always be like telling them the same story. And then they would have to be, writing it down and then doing some notes. And it was just, I always felt like it was just a very slow system, and I like it here that it's a bit more streamlined and modernized. And I felt like really anywhere in America it was just very slow, and again, just my experience only, but I just thought that was quite different. I think like the main point just to get across is that in Poland it's very much about like trying to help the people instead of having it be about the cash. And in the US, it's very opposite of that, at least from what I have experienced. And it's almost a crime to have to pay so much money to go to the hospital, go to, get your medication, have, like go to the ER or, pay as much money as you need to go to see a doctor just for a general checkup. Here in Poland, it's absolutely not that way. And I'm pretty sure it's like that throughout Europe with the socialized healthcare system. I know, like, we're not going to go into like the whole politics of all of that, but just having never experienced that before in the US, it just really opened my eyes to see how much more it can actually be when it's done this way. So, again, not bashing anything in the US, really, is just like here to show the differences and things that you can actually get when you have more of a socialized healthcare. And there's so much more behind the scenes that it goes into that. But just from what we've experienced, what we've paid into, we're very, very happy with the results that we've been able to get. And I will say that my husband and I are not sick people. We're using this healthcare just to really improve our lives and really try to get the things that we need to get done. Whereas in the US, we would never ever think about getting an ultrasound for, uh, the woman body or getting an MRI or an X-ray unless it was completely necessary. And even then we would think twice about it. So I just thought it was so interesting, and I'm really happy with the healthcare we have here. So if you guys have any experiences with the Polish healthcare or even like the European healthcare system, or if you have comments or thoughts about the American system, I would love to hear all of it down below in the comments. We can just kind of talk about it and kind of compare views and notes and experiences and things like that. So anyways, I hope you guys enjoyed this video. If you did, be sure to give it a thumbs up, subscribe for new videos every single Wednesday. And with that said, I will go ahead and see you guys next week with another video.